Hi everyone, welcome back to our channel. Today we will discuss about the most important topic for the Norcet and other nursing exam. Let's start. A patient cardiac arrest requires epinephrine. What is the recommended IV for adult according to AHA guideline, American Heart Association guideline 2022? Option A 0.1 mg, option B 0.5 mg, option C 1 mg, option D 2 mg. The answer is option C 1 mg. According to AHA guidelines, recommended epinephrine is 1 mg IV per IO every 3 to 5 minutes. We have to give the epinephrine 1 to 5 minutes, in 3 to 5 minutes during the adult cardiac arrest. Next, a patient with anaphylaxis requires IM epinephrine. What is the correct concentration and dose? Option A 1:1000, 0.3 to 0.5 mg, option B 1:10,000 1 mg, option C 1:10,000 1 mg, 1000 1 mg, option D 1:1 lakh 0.3 mg. In IM we are giving the 1:1000 concentration and the dose will be 0.3 to 0.5 mg, 0. in ml 0 to 0.5 ml. In the anterolateral thigh, this provides the rapid, because this provides the rapid absorption and is safer than the IV in non-arrested situation, and the technique used is Z-track method to prevent the leakage. Next, atropine is the antidote for which type of poisoning? Option A opioid overdose, option B organophosphate poisoning, option C benzodiazepine overdose, option D acetaminophen toxicity. The answer is option B, organophosphate poisoning. Atropine is a anticholinergic drug that reverses the muscarinic effects of the organophosphate poisoning. Salivation, urination and defecation, and meiosis bradycardia. It is given until the atropinization, dry skin, dilated pupils, heart rate greater than 80 is achieved. And opioid used for the naloxone. When the naloxone is overdosed, then we will use the opioid. Organophosphate poisoning, we use the flumazenil. benzodiazepine flumazyme, atropine, organophosphorus, acetaminophen toxicity. We use the antidote of N-acetylcysteine, Next, a patient receiving digoxin has been serum level 3.2 Ng per ml and reports nausea and yellow vision. Which medication should the nurse prepare? Option A, digoxin, immunofab. Option B, calcium gluconate. Option C, serum bicarbonate. Option D, flumazenil. The answer is option A, because the normal level when it will increase 0.822 Ng per ml. When it increase more than 2 Ng per ml, it is known as the digoxin toxicity. It's showing the symptoms like nausea. It's like nausea, then it's showing some visual disturbance, etc. So for treating the digoxin toxicity, we use the digoxin. Calcium gluconate used for the magnesium toxicity, and sodium bicarbonate used for the tricyclic antidepressant overdose or metabolic acidosis, and flumazenil used for the, already we told like that, benzodiazepine overdose. So the answer will be option A. Next, a patient on heparin develops a new thrombosis. The nurse suspects heparin-induced thrombocytopenia. Which medication should be administered? Option A, continue heparin. Option B, warfarin. Option C, direct thrombin inhibitor. Option D, aspirin. The answer is option C, direct thrombin inhibitor, because in HIT, heparin-induced thrombocytopenia is stopped immediately, and alternative anticoagulation with a direct thrombin inhibitor is started. Warfarin is contraindicated as it can cause the venous limb gangrene. So the answer will be option C. Next, a patient with status epilepticus is not responding to IV lorazepam. Which medication should be administered next? Option A, phenytoin or the fosphenytoin. Option B, carbamazepine. Option C, valproic acid. Option D, gabapentin. The answer is option A, phenytoin or fosphenytoin, because status epilepticus protocol, first we have to give the benzodiazepines like lorazepam and diazepam. When it will not work, then we will give the second line, phenytoin or the fosphenytoin. So here they already told not responding in lorazepam, so there is no responding in benzodiazepine. So we will go through the second line drugs, phenytoin or the fosphenytoin. So the answer will be option A. Next, a patient with severe hypertension is receiving IV nitroprusside. The nurse should monitor for which sign of the cyanide toxicity? Option A, bradycardia. Option B, metabolic acidosis. Option C, respiratory alkalosis. Option D, hyperglycemia. The answer is option B, metabolic alkalosis. In nitroprusside is metabolized to the cyanide. Cyanide is a toxicity caused the cellular hypoxia to metabolic acidosis like tachycardia, alter mental status, and pink skin. Treatment includes the sodium thiosulfate or the hydroxycobalamin. So the answer will be option B. Next, a patient with opioid overdose has respiratory depression. Which medication should the nurse administer? Option A, naloxone. Option B, flumazenil. Option C, naloxone. Option D, methadoxone. The answer is option A, naloxone. A patient opioid, we already discussed that antidote of opioids is naloxone. Naloxone is the competitive opioid antagonist that reverses the respiratory depression, sedation and hypotension caused by the opioid overdose. Next, a patient with hyperkalemia has ECG changes including peaked T wave. Which medication shifts potassium into the cells most rapidly? Option A, IV calcium gluconate. Option B, IV insulin with glucose. Option C, sodium pylostyrene sulfonate. Option D, IV furosemide. This is very important questions. The answer will be option B, IV insulin with glucose. IV insulin with glucose to prevent the hyperglycemia shifts potassium into the cells within 15 to 30 minutes by stimulating a sodium ATPase. Calcium stabilizes the cardiac membrane but does not lower the serum potassium. So the answer will be option B. Thank you everyone. Please like, share and subscribe our channel.